Remote patient monitoring, or RPM, is a rapidly growing area in healthcare, leveraging technology to monitor patients outside traditional clinical settings. This model has been particularly significant in chronic disease management, post-discharge care, and improving access to healthcare for underserved populations. However, understanding the reimbursement landscape for RPM is crucial for healthcare providers, as it determines the feasibility and scalability of such programs. This article delves into the Centers for Medicare and Medicaid Services, or CMS guidelines, recent updates, and proposed changes affecting RPM reimbursement. CMS guidelines for RPM reimbursements. CMS reimburses RPM services primarily under the following current procedural terminology, or CPT codes. CPT 99453 covers the initial setup of RPM devices and patient education. Reimbursement rate, around $19, although it varies by region. CPT 99454 covers the supply of devices for daily monitoring and transmission of data for 30 days. Reimbursement rate, around $54, again varying by region. This requires the device to collect data automatically and transmit it digitally. CPT 99091 covers the collection and interpretation of physiologic data for 30 minutes by a physician or qualified healthcare professional. Reimbursement rate, around $56. CPT 99457 covers the first 20 minutes of interactive communication like phone calls with patients per month. Reimbursement rate, around $50. CPT 99458 covers each additional 20 minutes of interactive communication with patients per month. Reimbursement rate, around $42. Key requirements for reimbursement. To qualify for CMS reimbursement, healthcare providers must adhere to the following. Medical necessity. RPM must be deemed medically necessary and prescribed by a physician or qualified healthcare professional. Device standards. Devices must meet FDA standards and transmit data automatically. Patient eligibility. Services are generally available to Medicare beneficiaries with chronic or acute conditions. Time tracking. CPT 99457 and 99458 require documented time spent on interactive communication with patients. Recent updates in RPM reimbursement policies. In the 2024 Physician Fee Schedule Final Rule, CMS introduced several updates to enhance access to RPM. Expanded eligibility, inclusion of patients with acute conditions beyond chronic conditions. Device flexibility. Allowance for multi-parameter devices, such as those monitoring both heart rate and oxygen saturation. Hybrid models, support for hybrid care models integrating RPM with in-person visits. Simplified documentation, reduction in administrative burdens for time tracking and device reporting. Rural health clinics, RHCs, and federally qualified health centers, FQHCs. CMS has expanded coverage for RPM services in RHCs and FQHCs, addressing disparities in rural healthcare access. These facilities can now bill RPM under General Care Management Services. Proposed changes for 2025 and beyond. Remote patient monitoring, RPM, has become an integral component of modern healthcare, enabling clinicians to monitor patients' health data remotely and provide timely interventions. The Centers for Medicare and Medicaid Services, CMS, and the American Medical Association, AMA, have recently introduced significant updates to RPM reimbursement policies and current procedural terminology, CPT codes, impacting how healthcare providers deliver and bill for these services. Elimination of the 16-day data requirement. Historically, to bill for CPT code 99454, which covers the supply of devices for daily recording or programmed alert transmissions in RPM, providers were required to collect patient data for at least 16 days within a 30-day period. This threshold often posed challenges, as some patients did not consistently transmit data for the required duration, leading to reimbursement issues. In response to these concerns, the AMA's CPT editorial panel convened in September 2024 and decided to eliminate the 16-day data transmission requirement for CPT code 99454. This change, effective January 2026, aims to provide greater flexibility for providers, allowing them to bill for RPM services even if the 16-day threshold is not met, thereby enhancing patient care and provider reimbursement. CMS updates for 2025. CMS has proposed several changes to RPM and related services for the 2025 calendar year, Advanced Primary Care Management (APCM) codes. CMS plans to introduce new Healthcare Common Procedure Coding System (HCPCS). G codes for APCM services. These codes will bundle elements from existing care management services including chronic care management (CCM) into comprehensive packages. This initiative aims to streamline billing processes and enhance care coordination. Billing changes for FQHCs and RHCs, federally qualified health centers (FQHCs) and rural health clinics (RHCs) will transition from using the general code G0511 for remote monitoring and care management services to billing each service individually using standard CPT codes such as 99490 for CCM. This shift is designed to align their billing practices with those of traditional ambulatory care settings and ensure appropriate reimbursement rates. Introduction of new telemedicine codes. The 2025 CPT manual introduces 17 new codes, 98008 through 98015, for audio-visual and audio-only telemedicine visits, applicable to both new and established patients. These additions reflect the growing demand for diverse telehealth services and aim to provide more precise coding options for various telemedicine encounters. However, CMS has declined to recognize 16 of these new codes, citing statutory limitations that require the continued use of existing evaluation and management codes for these services. Implications for healthcare providers. These updates signify a shift towards more flexible and comprehensive billing practices for remote monitoring and telehealth services. The elimination of the 16-day data requirement for CPT code 99454 will likely reduce administrative burdens and improve reimbursement rates for RPM services. Additionally, the introduction of APCM codes and the adjustment in billing practices for FQHCs and RHCs reflect a broader effort to streamline care management services and enhance patient care coordination. Integration with remote therapeutic monitoring. CMS is considering proposals to align RPM and RTM reimbursement structures, reflecting the increasing use of devices for non-physiologic monitoring, such as musculoskeletal conditions. Value-based care models. Future policies may incentivize the integration of remote patient monitoring into accountable care organizations and other value-based care frameworks. This shift aims to reward outcomes over volume. Expansion of covered devices. Proposals include broadening the definition of remote patient monitoring devices to include wearable biosensors and AI-enabled monitoring tools. Healthcare providers should familiarize themselves with these changes and adjust their billing practices accordingly to ensure compliance and optimize reimbursement opportunities. Staying informed about these developments is crucial for leveraging remote patient monitoring and telehealth services effectively in patient care. Challenges and opportunities in remote patient monitoring reimbursements. Challenges: administrative burden, time tracking, device documentation, and compliance with CMS guidelines require significant effort. Reimbursement variability. Rates vary by region, potentially limiting access in underserved areas. Patient engagement. Ensuring patients use devices consistently remains a challenge. Opportunities. Chronic care management. Synergy. Combining remote patient monitoring with chronic care management services can enhance patient outcomes and revenue. Telehealth integration. Remote patient monitoring is a natural extension of telehealth services, enabling comprehensive virtual care. Technology advancements. Innovations in wearable devices and AI are expanding the capabilities of remote patient monitoring, making it more appealing to payers and providers. Conclusion. The reimbursement landscape for remote patient monitoring continues to evolve, reflecting advancements in technology and shifts toward value-based care. Understanding CMS guidelines, staying updated on policy changes, and leveraging opportunities for integration with other care models are essential for providers looking to implement or expand remote patient monitoring programs. With proper planning and adherence to regulations, remote patient monitoring has the potential to transform healthcare delivery and improve patient outcomes on a broad scale.